So again, good morning. My name is Simone Parker, and I'm with our stakeholder relations team here at CalPERS. It's our privilege to host today's event and introduce you to your representative on the CalPERS board, Yvonne Walker. But before I do that, I'd like to explain the format of this meeting for those that haven't participated before. It's simple. Yvonne will provide some updates on CalPERS, and following her remarks, we'll take questions as time permits. If you have a question when it comes, you can raise your virtual hand and we'll call on you. You can access that feature by clicking the heart icon in the toolbar at the bottom of your screen and selecting the raise hand option. Once we call on you, you can click your microphone to unmute and ask the question. If you need accommodations because you're unable to raise your virtual hand, you can send a message in the Q&A so one of our moderators can assist you. If you need closed captioning, you can click the CC button on the toolbar for that feature as well. This webinar is being recorded and will be posted on our YouTube page next week. If you want to automatically be notified that the video has uploaded, you can always subscribe to the CalPERS YouTube channel. So we only have an hour today, and I want to make the best use of our time. So with that, I'm pleased to introduce Yvonne Walker. She's serving her first term on our board. Yvonne has served California and our nation for more than 35 years. She's worked as a union president, retirement security advocate, experienced pension fiduciary, state worker, and a Marine Corps vet. She's known for being one of California's foremost leaders in fighting for pension and health benefits earned by our members and retirees. So please join me in welcoming Yvonne Walker.
Hey everybody, it is good to be back with you again. I feel like it's been forever since we've been with each other. I hope everybody had a good holidays and that they were uneventful. Just so you know, mine went very well. I spent it with my family down south. And so I'm going to jump right in. I'm going to move through quickly. Like always, I like to make sure that I'm giving you the maximum amount of time for questions. So we just came off of a 2-day board education day and stakeholder forum. And I want to thank all those that attended in person and online. The education day covered topics about our investment strategies, progress being made in our health program, and there was a really fascinating discussion about the effect of AI on investment markets around the world. And then the stakeholder forum, it referenced brain health and healthy aging and how to protect ourselves from identity theft. One thing I forgot to mention on the education day, there was again about how to protect ourselves from cyber attacks and just the whole general that was on that first day. And then it went down to the level of how to protect ourselves from identity theft. And then there were, things about our healthcare. So I'm sure you all have known that have been impacted by this. We have switched over our pharmacy benefit provider from Optum to CVS, the Silver Scripts. And so there have been, glitches and things that have happened that we are already working for. And some of them, like you can try to anticipate what's going to happen. And we did as much as we could, but until it actually goes live, you don't actually know what it's going to be. Prior to the webinar, there were a lot of questions, a lot of concerns and comments about the transition. Some of them included, your medicines not being covered, costing more, that you having to get prior approval. One of the things that I heard while we were at the meeting was one of our members hadn't switched over. When they did it, they switched over the prescriptions, but they didn't switch over the payment, which they couldn't. So that's something you have to go in and do manually. I say all that to say that all the questions that came in that was related to the pharmacy switch, the pharmacy benefit manager switch, I am going to refer them to our health team and have them respond to you, because I feel like that will just take up the whole of our call, and I really won't have good answers for you because some of it was very specific. So I just wanted to let you know, and I do appreciate how annoying, confusing, and everything else it is having to switch over, but I I feel confident that it will smooth out and we will get rid of the glitches and it will be it will smooth out. In our other health news, right? We received a presentation about the progress being made to improve health outcomes for conditions like hypertension and diabetes. And the good news is that our health plans are making progress. And so that's good, and we'll see that in the future. There were questions about the PPO pricing, and how that has impacted folks and being so high. The good news is we expect to see some positive changes for the PPO pricing in 2027. If you remember, we added a surcharge in 2023 to help build rebuild the fund that pays for that healthcare after the huge demand for services caused by the pandemic. And that surcharge will be removed starting with the 2027 premiums. So I'm hoping that we will see some impact from that. Moving on to where we stand in the pension fund and where we stand financially. We are funded at 84% with nearly $600 billion in assets as of December 31st. And that's a 5% increase to the funded status from 6 months earlier. And so that is a good thing. We are moving forward with our total portfolio approach. And I'm looking forward to that as we go on throughout the years being the right approach. There were several questions that came in before the meeting on whether the state budget was going to have an impact on our healthcare premiums, right, or on just CalPERS in general. And no, it will not. And one of the things about healthcare and with the state is that it's a pay-as-you-go for the state. So they, we present them a bill and they pay it 100%. That's how it works, and that will continue to be. And I think that was it. I've tried to combine as much as I could. So I think I hit all the highlights. If I've missed them, feel free to get in the chat and we'll go from there. But I'm trying to provide as much time as possible for you to get in with your questions, comments, and everything. Yeah. So with that, I'm going to turn it back over to Simone. She'll walk us through, what we need to do to get here.
Wonderful. Thank you. All right. So it looks like we have a couple hands up. Michael, if you want to take yourself off mute and ask your question, go ahead.
Hi, Yvonne.
Hi, Michael.
Thank you so much for doing this. I guess my question you answered initially, it's regarding the PBM, the Pharmacy Benefit Manager. I will just say the experience has been quite challenging and, for lack of a better way of putting it, bad. Long story short, I have generic meds that I take for a number of conditions for a middle-aged guy, like cholesterol and all that stuff. And you're now having to get pre-auth for some of this. And I realize what you said, you're going to refer all this to folks, and that's fine. I get that. You can't get into everybody's personal issues on this call regarding this matter. But one of the things that I wanted to share was that when we call customer service for the PBM now, they're saying, well, that's because, in my case, well, that's because you're on a Medicare plan, and that they have all these requirements. Well, I did research. None of that's accurate. None of that was true with the previous PBM. So it's just very frustrating in terms of the lack of answers and the misdirection. I have almost 30 years of state service and had to medically retire. I've never had an issue with my health insurance or with PBM, and this transition has just been, I'll just say awful. Let's just say that.
I appreciate your discretion in the description, Michael. Like I said, I'm going to refer all of the questions and the comments about what's happening to our healthcare team so that we can they can get in touch with you directly, right? And we can figure this out because sometimes, it's hard to know where to insert, right? And what we're hearing. And it'll be a lot easier for our team to be able to say, look, this is the experience. I don't know what you're saying, but this is the experience and this is what we need fixed, kind of thing.
I'd appreciate it. And if I could say one other thing.
Absolutely.
I understand that there are challenges during these types of transitions because of my own professional experience and all of that. I get all of that. But I will also say that for the first time ever, in dealing with any of my health insurers or providers or anything like that, the customer service response and the way I have been interfaced with, treated, is just, I will say, less than professional in most cases and not very kind, frankly. And um, I only say that not to be, to get everybody to, feel bad or poor me or whatever. But, this is a significant contract they have from CalPERS. There's a lot of money behind this. So the least they could do when they're telling us they're not going to provide our meds or what we need or the support that we've previously received is, be professional and appropriate about it.
Absolutely. And I don't think that I don't think anyone should ever feel afraid to say, like, look, this is not, even if you're delivering bad news or whatever, this is not the way that you deliver it. We expect better. I know CalPERS expects better. And it's important for us to know this so that we can make sure that we are setting the expectations with this new benefit manager.
Yeah. I thank you for your time. I could say a few more things, but I want to give others an opportunity. So thank you so much. And I would appreciate getting a call back from somebody. Thank you.
Absolutely, Michael.
Thank you, Michael. Okay, Christopher, you're next up. If you will come off mute, you can ask your question. Christopher, are you there? Christopher Lim?
Hello?
Hi, Christopher.
Wow. Fantastic. Thank you very much for taking my call. I noticed that my HMO was an increase, and when I called in CalPERS, I was told that my department did not coverage, and I was just wondering, is that something that I can expect in the future?
So I didn't understand your question, Christopher. So one more time for me.
Yeah, I apologize because
That's
I'm
okay.
hearing echo from my phone. There was an increase in my HMO, I believe.
Okay, and
And
your premium?
when I called in and asked why, they said that the department or where I work, where the department rehab did not cover it, or they just covered enough, and therefore there was an increase about like $13 a month or something like that.
Okay, you know what, Christopher? I don't know why for your health premium it would have gone back to your department. So I am going to ask you to you called into our call center?
Yeah, I called CalPERS.
Okay, Christopher, we're gonna take your name down. I'm gonna have somebody call you directly because that doesn't make sense to me.
Okay.
Okay?
All right. Thank you.
Thanks, Christopher.
I think the next caller's name, is it Rainey? You want to come off mute and ask your question?
Yes, hello. Yes,
Hi.
Hi,
my name is Ronnie. Thank you for doing these. I've come to everyone that I'm, invited to. Thank
I
you.
appreciate you. Thank you.
So I have a dependent covered under the health plan. I have a
Uh-huh.
PPO, and I've had trouble getting small providers covered. Like my physical therapist last year said that Blue Shield was
Mm-hmm.
was paying me after Medicare instead of paying them what they would owe what they determined was owed. So my physical therapist said that they did this to a lot of their customers. I asked whether it was happening to just CalPERS retirees or if it was if it was generally with them, or and he said, yeah, I think it's he didn't get back to me on that and check, but my understanding is that it's a way for them to create sludge. This is what he called it, sludge, in the system to try to hope that people don't cash the check that comes to their house. The check comes, and the explanation of benefits don't say what the thing is for. So there's all this confusion that comes around the paperwork that attends the the reimbursements. But so I made a bunch of phone calls. Apparently, in May of last year, they started paying the therapist directly
Okay.
and not sending checks to me anymore. But
Okay.
now it's starting to happen with another. I'm starting a new service up with another therapist, and they say, oh well, my there's this trouble with my certification all of a sudden with Blue Shield. I had
Hmm.
no trouble with using them under Anthem.
Uh-huh.
For some reason, Blue Shield is not recognizing them as still in network. And so, I was just told, well, I'll have him call the provider line. And, they couldn't tell me what was hanging his credentialing up. So this is all very frustrating. And then also for that provider, it's working with my dependent. And then I have to go through Included Health.
Mm-hmm.
Included Health is, I guess, what manages behavioral health and therapy. Um,
Mm-hmm.
I don't know if they do everything um, for like customer facing service for Blue Shield now for people that are on the basic PPO plan.
Yes, I believe they do.
Okay, so they're basically all the calls have been outsourced for
To include it, and it was supposed to make it better. I'm hearing from you, maybe that's not the case.
no, and also for behavioral therapy and mental health care, they subcontract yet again to something called Quartet.
Hmm.
And Quartet is, like a network of providers that will do virtual health. It's
Mm-hmm.
very hard to get an appointment with a psychiatrist or a therapist for mental health through Quartet or Included Health. We spent a year last year trying to figure out how to navigate Quartet, and the calls were coming from all over California, some from out of state,
Mm-hmm.
and trying to make, appointments virtual only. And this isn't, how to work with mental health. You need to see people in person, and there's just so much, that goes on in person that you can't see on a screen. So
Right.
this is this is a concern. It's like a bifurcated system. It's one way for me, and it's a completely different system for my son. And then having to navigate both, systems. The physical therapist thing got straightened out last year, but now it looks like I'm going to have to start all over again with something for him because the therapist finally has an opening. So, um, the one that we've used before in the past, and not anybody knew that Quartet was trying to send him to. So, yeah,
Okay.
I don't know how that can be smoothed out, or just if many other people have this situation where there's a dependent that's not a retiree, that's
Right.
that has to deal with this kind of complexity, but it's mind-boggling sometimes to try to figure out all the phone numbers, all the missing links and all the things that are breaking and going wrong with the system, especially in mental health. It's
Right,
really
right.
frustrating.
Okay. So Ronnie, this is the first time I've heard about the difference between the retiree and somebody who's not retired as a dependent, and that creating another barrier. So again, what I'm going to do, I'm taking your name down and I'm going to forward this to our healthcare team and
Okay,
have somebody get in touch with you directly.
okay.
You
And in
know,
the meantime, is there a phone number that I would call myself to get out of having to deal with Included Health or Blue Shield? At
okay, so what you
Mhm.
can do is call our 800 number, right?
Okay,
And explain what the problem has been, right? And they
okay,
will have somebody get in touch with you.
okay. So
Yeah.
yeah, if you put the word through and then I put the word through, hopefully,
Hopefully we'll get there.
between the top and
Yes, we'll meet in the middle.
yeah, you're the top down, I'm the bottom up approach. So
Yeah, I think you're the top down and I'm the bottom up. But either way, we're
it
going to
feels
meet
like
in the
I'm at
middle.
the bottom. Okay. All right. Thank you.
All right. Thanks, Ronnie.
Pat, if you want to come off mute, you can ask your question.
Can you hear me? This is Pat.
Hi,
We
Pat.
can.
How are you?
Hi, fine, thank you. Well, not so fine. So I'm one of those people whose prior authorization for a specialty med was not honored. One of my meds they don't cover, and none of the meds transferred from Optum to, none of the prescriptions transferred from Optum to Caremark. So it's like my physicians and I were just starting all over again. And so I guess I need your healthcare team. But I remember being given the impression from CalPERS, and I also was told yesterday that prescriptions transfer, and that's baloney. And it's baloney that if anybody left us as the impressions that prior authorizations would transfer.
So I know that there was, it wasn't across the board, but I know that there was, that the healthcare team was aware of some of the prescriptions that didn't, that for what there was a glitch that didn't get transferred, and they're already working on it. That I don't have a resolution yet, but I'm still going to put your issue out there for them,
Okay.
so that it just stays, up on the skyline. And because I believe that, if one person is having the problem, other people are having the same problem, and they might just not be calling in just because they're frustrated. So,
Yeah. Mm-hmm. Okay.
I am going to transfer this to the healthcare team. That would be the better place to have better responses,
Okay.
and better to have them be the intercedents, if that's a word.
Okay, thank you. Please do.
Okay, Pat, thanks.
Thank you. Paul, you're up next. Go ahead and come off mute, please.
Hi, can you hear me?
Yes, Paul, how are you today?
Oh, fine, thanks. The question I have is, can a CalPERS retiree who moves outside the U.S. But stays current with Medicare Part A and B still be covered by the CalPERS supplemental Medicare insurance if they return to California just for specialized care? In other words, they're not moving back, but they come back to California for specialized treatment. Now, I called Medicare, and they said as long as I stay current with Medicare Part A and B, I'll be covered, when I come
Right,
back.
right.
I called CalPERS, and they said talk to Blue Shield. I called Blue Shield and they said, talk to CalPERS.
And so now you're talking to me. All right, so let me tell you what I know, Paul, because this has come up before. So here's what I know, that Medicare doesn't cover outside the United States. That's just it. But
Yeah.
coming back for care, right? And if everything's paid, all things being equal, and you're in the, I'm assuming the PERS, the CalPERS PPO plan,
Yes.
then yeah, once you're back, yes, it should be covered,
Okay.
but it won't cover you outside. I mean, the Medicare
No,
part
no,
won't cover you outside of the country,
no,
but here, yes, if you're here,
no,
yes.
no, I realize that because my wife and I, we have established um, specialist physicians that we're seeing for our various and sundry ailments, which I guess just comes with being old.
Right.
And we would like to be able to come back if we needed that specialized care.
Right.
And just wanted me, I know, well, Medicare says we're covered with
Mm-hmm.
Medicare. I just want to know that the PPO coverage would also be effective.
Yes.
Okay.
Yes.
Um, so if I have any issues, I'll just say, talk to Yvonne.
Well, you can say that. You can say that. If you have any issues, though, one, I would ask you to call in to the 800 number. And then if you're not getting resolution, please get in touch with me.
Okay. Okay.
And so that I can, like be an ombudsman on this.
Well, thank you so much. I appreciate it.
Absolutely.
And I'll just point out that the 888-225-7377, our contact center number, is under Yvonne's name on the screen. So if you need the number, it's there for your convenience. All right, looks like Laura, you're next on the list if you want to come off mute and ask your question.
Yes, can you hear me well?
Yes,
We
ma'am.
can.
How are you today?
I'm well, and thank you for doing this, Yvonne. And mine is a more general question, not about my specific enrollment, but
Okay.
it's very much a CalPERS question. So, as you know, for those of us who have traditional supplement to Medicare PPOs, such as PERS Platinum, which is what I have, with limited exceptions, our benefits are dependent on what Medicare covers. Medicare covers it, the PPO covers the rest. The exception being what CalPERS calls benefits beyond. There are a few extra benefits that are in the plan, which is good because we're paying a lot. You may be aware that as of January 31st, Medicare coverage for telehealth visits expires. This is at the
Yes.
congressional level.
Right.
And and it's been, it's been extended a couple of times before. It should be a bipartisan issue, but as you and I know, there is almost no such thing now.
Right. We're
And
living in a different world.
we are. So my question is twofold. One is, what is CalPERS doing? Is CalPERS playing an active role? And what is CalPERS doing to try to make this happen? I do understand there are two pieces of legislation pending. I don't have the bill numbers in front of me. One that would make the change permanent, one that would extend it to 2027. So the first question is CalPERS actively involved? What are they doing? What do you know about it? The second question is, since PEMCA, the state statute that deals with retiree and employee health care, anticipates parity between retiree and non-retiree benefits, is CalPERS actively considering making telehealth visits a benefit beyond if Medicare coverage does expire? And if
Okay.
not, I very strongly request that CalPERS does that.
Okay, I'll answer the last one first, that I don't know if they're considering covering it or not. But I will inquire and I will advocate for them to make that, one of the benefits beyond, if possible. And I do know that as it relates to health, and, at the federal level, right, that we are very active in advocating for, our different positions and everything else. I think last month our Chief Medical Officer, Don Moles, had testified before a committee on some of the things that we're doing at CalPERS that are actually groundbreaking in what we do. And this is something that we are very aggressive about. So yes, I know that they are. To tell you exactly what it is that they've done, I can imagine they've probably submitted letters, right?
Yeah,
And
yeah.
testimony, because anytime they do rule changes, right, they look for comments on what to do. And we are very active in making sure that we are responsive to that. Because yeah, that was one of the unfortunate things because it the telehealth visits were part of the pandemic responses.
Exactly.
And you're right. It should have been a bipartisan issue. It should have been like, you know what, we had never considered this before, but now that we have it and we've had years to see how it works and how much it helps our system, this
Yes.
is something that we should continue, right? But like you accurately pointed out, things that should not be political and just be common sense. We're having a bit of a challenge with those things right now.
Okay, so thank you for that. And it's possible that some rural exemptions and disability exemptions will remain, but I'm talking about the broader coverage that
Overall,
telehealth is
absolutely.
just so great. Yeah, thank you. I do hope that CalPERS, if it doesn't go through, and I think the last time around it went through at the last minute, so we don't know,
Right.
but it's January 31st, so this is
Right.
coming up fast. So I do hope that if it doesn't, that CalPERS will make it a benefit beyond. I have an unrelated question relating to long-term care, but I can't see on my end how many hands they're up. Is it appropriate to ask, or would it be better to go back into the queue?
Just ask why I have you.
Okay, great. So very concerned about CalPERS long-term care program. I'm very familiar with this. I worked at CalPERS on health programs and subsequently as chief counsel for another state agency on health programs. And I'm very familiar with the phenomenon of a death spiral in insurance, where as prices go up, more and more only those people who need the benefits stay. You get a sicker and older pool, the benefits go up until it's unsustainable. We're already seeing some of that in our/my long-term care insurance premiums. And I know that there's a big notice on the website for the long-term care administrator that they're not taking any new applications. So to me, just as a layperson who is really familiar with insurance concepts, this looks like a death spiral. My concern is that if, I'm 75 now, happen to be very healthy, but we have insurance in case we need to use it. My concern is that it won't be there when I do. And the current statute, the one that passed a few decades back, requires that the program be self-sustaining.
Right.
If it goes into a death spiral, it's going to need new legislation to basically hold those of us who have been paying into the system harmless. And I'm wondering whether CalPERS is doing any work in anticipation of that to make sure that, because again, right now the state can't subsidize. That would take
Right.
legislation, that would take
Right.
appropriation. So what is CalPERS doing to make sure that I have my long-term care coverage when I ultimately need it, if I ultimately need it?
You know what? I'm going to have to get that because it's been a while since we've discussed it at the board. And I don't remember off the top of my head. And I really hate giving out bad information or
Sure.
information that I think is right. But I will check back in and try to get a better answer than that. But I understand exactly what you're saying, and I don't know what, if anything, that we can do.
Right. Right. And I mean, CalPERS by itself can't do anything. The
Absolutely.
state can't. It does require legislation, which of
Yes.
course isn't within CalPERS power, but
Right.
it's within CalPERS power to advocate, to advise, to provide technical
Absolutely.
support, et cetera. And that's
Absolutely.
what I would hope for. So, Yvonne, thank you very much for your time.
Absolutely. Thank you, Laura.
Thank you. Lisa, you're up. I believe the team helped you figure out how to come off mute. If you want to click the mute button. Yep,
Thank you. I think I did.
Oh,
Can you-
you're
yay,
there.
Lisa.
Welcome.
Hi, great. Well, thank you so much, Yvonne. I just want to piggyback a little bit, in a general sense about the transition from OptumRx to SilverScript. I have also been dealing with it very directly with SilverScript. I have a name and direct phone number with a person I can deal with, and very directly with CalPERS. I have a name and phone number. And I appreciate all of that. I just really want to share what I think you, as representing us, may be able to bring to the board.
Okay.
And that is, I have kept every letter, every communication from the very beginning. And it's very interesting to me. And I called from the very beginning. I'm a type 1 diabetic, and
Mhm.
my insulin type, the insulin I use is not on the formulary. But because you guys are CalPERS, I didn't panic. I said, CalPERS take to myself, CalPERS takes care of its members. And that's
Mhm.
my experience. So right down to it, I agree with Michael wholeheartedly. The transition has been bad, terrible, and it could have been diffused at the very beginning. Um, Also, the selection to go to Silver Script, but I don't want to waste time now on that. Members had no voice. We had no open enrollment. When asked, how did it was decided, I was told it was a board decision. Um, so no voice and no choice is not how CalPERS operates, at least not in my understanding. So the first communication was from SilverScript. It was dated October 30th. It had no CalPERS logo on the letter. The second communication dated December 4th was from SilverScript. And then they added a reference to PERS Platinum, not CalPERS. The third communication dated December 26th had a different tone completely. I believe that's when the complaints came in, when we got
Mhm.
the first letter that said we're not covered. And I believe CalPERS medical team or whomever was responsible said we've got to get involved. And your logo is on that letter. Our logo is on
Mhm.
the letter. The next one that came to me on January 13th is back to SilverScript only. What I see happening is SilverScript is operating in isolation. I do not see representation of CalPERS here. I have personally talked to SilverScript and CalPERS, and there is a disconnect, a very bad disconnect between CalPERS and SilverScript. Um, in that way, I the letters themselves are form letters. SilverScript is not addressing CalPERS members, and CalPERS is not addressing in the communication coming from SilverScript. My belief, and correct me if I'm wrong, is that SilverScript is operating as they always operate, as an insurance company dealing with, and they're sending out their form letters. I do not believe anyone from CalPERS is overseeing this process at all. And the process that only on an individual basis. And that's been my experience. So your advice to everyone to call CalPERS will make a big difference. But what a waste of time and energy that CalPERS people and even SilverScript people have to go through. There's got to be some leadership and some management and operations management, and it's got to be joint and collaborative because SilverScript, for example, one of their letters starts with SilverScript employer, PDP sponsored by CalPERS. I didn't, where does an employer enter into this? I mean, they're taking form letters. They're not working for us. They're the employer. And what it looks like is that CalPERS has subcontracted with SilverScript and then felt they were competent and capable of doing what a company does for a retiree group. Maybe they bit off more than they can chew. I know we are millions of people. And so I really think that you can represent us there, your voice and our voice um,
Mhm.
about the transition. I also found out, and I was also given the same impression that others have shared, that I called immediately when I heard SilverScript was taking over. I know nothing about SilverScript, but all I know is I had no voice. And I wanted to know, what can I do to make a smooth transition for myself? And the timing was terrible. You guys know that. The letter that went out was not written to your members. And now I'm still getting communication from them that is form letters without CalPERS. I would go beyond overlooking their letters. I really feel that CalPERS needs to put some resources in a preventative, positive way to make sure that our members are hearing. I mean, the difference between the letters with your logo on it says, get ready for 2026. And every single thing said, talk to somebody if you're not getting what you want. Not what you want, but what works,
What you need.
what you need. I'm a type 1 diabetic. You're talking about my life. I have no choice. And like has been shared before, people, I don't have to take time for that. You know, you get it. I don't,
Mhm.
when I talked to CalPERS, I said, I don't think there was one diabetic on the board, because this couldn't have happened this way unless you were told that exceptions can be made. There's a process for it. But that is not, it's
What
only,
is happening?
yep, and it's not only happening, it's not what's happening um, on any information that's coming out, any printed information that's coming out. And I received two letters, the same ones, of the same prescription that's not being covered. So there's even, and I feel for the workers. I feel for the people who have to, this is major change in a
Mhm.
very short period of time. And I appreciate you honoring that when you said that in the beginning. But I also know, I found out, and correct me if I'm wrong, that formulary changes can be made at any time.
Yes.
And CalPERS does have that. We don't have to wait for certain things. And I am
Right.
also Medicare. I'm CalPERS Platinum. I thought that was my best option to go with to get coverage as a diabetic. And
Mhm.
and I have, I mean, anyhow, um, there's got to be a way. And I do feel that CalPERS is capable and competent. And I also want to add that every individual I spoke to at, well, particularly one at SilverScript, particularly one at CalPERS, um, were wonderful. They really want to help us. And that was my biggest feeling when I got in that first letter from SilverScript, was that,
Right.
this is really lowering my trust in CalPERS to represent me. So I think I've made my point. I'm available. Um, my situation has not been resolved yet. One
Okay.
part of it has, but everyone in the chain, everyone in the line does not know what's going on. People are not being informed. The pharmacy, by the way, CVS pharmacy, I was with Walgreens. CVS,
Mhm.
you cannot get through. They use a virtual assistant. You cannot talk to anyone.
Mm,
know it. They're not fixing it. I don't know if CalPERS can influence that. That's another story. But
okay.
it seems to be the way Silver Script operates or CVS is operating. And it's not right for CalPERS members. Sorry for taking so long. Thanks.
No, that's all right, Lisa. Let me just say that I again for everybody apologize for the experiences that you are having. I will tell you though that that CVS, the Silver Script, say they've added a whole team for CalPERS, right, to deal with. We
Good.
do have we do have people that are overseeing. Also, I should have said this in the beginning, but I'll say it again. In addition to just making sure that the healthcare team has all of this information that we have, when we send out the after questions that we send out, there's going to be links because we have FAQs, we have different things that deal with this, and so we're going to include the links on that in that so that you'll have that available. Um, I would just say for a transition this big, in my experience, it has never gone as smooth as we would like. But I will say that the team tried as much as possible to make sure that they had things in place. We did, YouTube webinars, seminars, throughout. We started earlier than we did with the health plan change that we did. And so trying to anticipate as much as we could problems. But the thing I can tell you is we're going to fix this. It's going to smooth out. We're going to fix it. But, this is our first month. Give us a little grace and we'll continue to slog through. And I will also tell you, not only from my perspective, from my fellow board members and the whole CalPERS team, our commitment is to you, right? And to, try to fix what we can and make things, as soon as possible. None of you are just speaking in the wind. We take all of this very seriously, and we're going to continue to work until we get it smoothed out. So, but again, apologize for the initial glitches.
Well, thank you, Yvonne, and thank you so much for. It's a pleasure to meet you this way, and it renews my belief in CalPERS as representing us as retirees in
Absolutely.
a public service life.
Absolutely.
Yeah. Okay, I'll let someone else go. Thank you so much.
All right. Thank you, Lisa.
Thank you. Maria, if you want to come off mute and ask your question.
Hi, can you hear me?
Hi, Maria. If you could speak up just a little, would be great for me.
Sure, thank you. My question, and please let me know if this is not the right forum, but I am also a CalPERS retiree from a school district. And my husband is under my medical coverage. He worked for the federal government and USPS for almost 30 something years, but he was the last 10 years of employment, he was under CalPERS with me because it was more affordable. So what will happen if I die first? God forbid, but it's going to happen. What happens to his medical coverage? Will he be left without medical?
Oh, that's a very good question. I don't know that if he'd be left without medical. I don't know. I don't have the direct answer that he'll still be under your CalPERS healthcare. I don't think so. But I will check that out. What will probably happen is that he'll be under, if he's old enough, under Medicare.
Right. We are currently, I mean, I have heard everybody's issue, and it seems like, healthcare is our biggest concern after we retire, because between my husband
Absolutely.
and
That's when
I,
everything goes wrong.
yeah, but right now it's like we're spending almost $1,200 in medical insurance between my husband and I. and because we still pay Medicare, 202 every month, each 202 plus my Kaiser, plus my Cobra for my dental and my vision. So when you add up, it's almost $1,200. And now we worry that if something happens to me, he'll be left out without medical and have to depend just on Medicare, which is, we all know, not the best plan. And he does have medical conditions that require a little bit more than what Medicare provides.
Right. So like I said, I don't have a direct answer for you, but I will, this is the first time I've been asked something like that. So now I'm going to find out and we'll get back to you.
Thank you.
Okay.
Sorry, I just accidentally closed my screen that had the hands raised.
Oh.
Rochelle, you're next. Go ahead and come off mute and ask your question. I see you're off mute, but I don't hear anything. Are you there, Rochelle?
Yes.
Okay, we can hear you.
Okay. All right. I have a question. A lot of the paperwork from CalPERS and SilverScript, etc., have been sort of late coming out. In other words, you get something in the mail and it's dated December 15th and you wind up getting it. Excuse me, I'm sorry. You wind up getting it, in sometime in the end of January and everything. Okay. Anyway, I'm sorry about that. I don't know how to turn that off. All right, let me just take this. Okay, that should take care of it. Anyway, okay, so that became a problem. Okay, that you get something like this is everything's going to be covered or blah blah blah. But one thing that hasn't been addressed that really threw me for a loop was that when one of the latest things that came out was the agreement between SilverScript and CalPERS having to do with basically a fine for SilverScript if they do not meet their budget agreement with you, with CalPERS.
Right.
I was shocked. I have to tell you, I was shocked to see that. Where does that money go if they do get fined for going over the budget? Who does that go to?
It goes back into the program to lower the cost in the programs for our members.
Okay, so in other words,
they have benchmarks they have to hit.
Yeah.
And if they don't hit them, there's a penalty, right? And
the only way they can meet their benchmarks, though, is to deny people coverage for certain specialty or different types of drugs.
Oh, that's not true. That's not true. No.
How else can they meet it?
Huh? They have standards that they have to hit, and the standard to hit the standards isn't to say like, oh, we're not going to do this, this, and this so we can hit the standards. They know what they have out there. They have signed a contract saying, yes, we are going to hit these standards, and we hold them accountable to it.
But the standards are, if somebody wants a name brand, all right, or you keep getting these letters that say, we're not going to honor that. You have to switch to another medication, all right, something that you've taken maybe for 10 years through the previous drug coverage, all right? And all of a sudden, oh no, that one's too expensive. We don't want to cover that.
I don't know if they say, and I'm sure it seems that way, but I don't know that they say, oh, that's too expensive. We don't want to cover that.
Well, what's the other reason? What would be the other reason for not honoring that?
I'm trying to tell you.
Okay.
That particular drug might not be in their formulary. They might have one. They might have one that's equivalent to it, and yes, you'll switch over to that. But I mean, as an example, I have, a drug that I take every month, have to. And, when I went to refill it, the pharmacist let me know, like, look, we had to switch to a different thing. It's the same, it has the same property. It's just a different generic of the same drug. So, I mean, that happens even when we're not switching to a different PBM.
Okay. So basically, if they go under budget, then is there a reward? In other words, the budget that you've decided that they have to service all of your members for medication, is there
I don't think it is. I know it's not just, like, hey, the budget for this is $5,000. And so if you hit that, that is not how it is structured, right? It is more along the lines of, are you hitting the benchmarks on our represented folks on getting their medications, on the different, the different. It's not a money benchmark; it is a service benchmark, more or less.
Oh, it doesn't come across like that.
Oh,
it doesn't come across. It talks about basically being under budget.
Okay. I haven't seen that, so I can't comment one way or the other. I just know that's not the way it is set up.
Okay, so it's rather misleading then, because it sounds like if they go over budget, they're going to get fined some way, and that fine is going to go to CalPERS. All right, so there's an incentive for them to meet the budget or go under budget.
Yeah, that's not how it's set up.
Well, that's the way it's coming across.
Okay.
And a lot of obviously people that that are still in, and all in CalPERS now that made the change are having, that's the assumption that is going on. All right, that they denied coverage for this thing that maybe is a name brand rather than the generic, or something that their doctor prescribed the name brand for a reason for years. And then all of a sudden, now they have to go to the generic or something completely different. All right. And it's because CalPERS and SilverScript have decided that something cheaper is better for their bottom line than for our health. So please take that into consideration.
Okay. And I would just say, that could be, if we've been with the pharmacy benefit manager for years, at least 5 years, right? And then switching over to a new one. Mm-hmm. And if your doctor prescribed the main, the non-generic, right? The name brand and the non-generic, and the old pharmacy benefit manager was covering that, I will guarantee you that when it initially happened, there was extra paperwork that your doctor had to submit to justify getting the name brand and not the generic, right? And so that might be the process that is happening again.
So in other words, the doctor now has to say why they're not taking the generic rather than the other.
Right, why it doesn't work. Yes. Why that doesn't work, and why this, why it has to be the name brand and not the generic.
Okay. All right. It's really sounding like a kickback, or that we're going to be, or that we're going to be, we're at the mercy. I guess
we don't do kickbacks, and we're not at the mercy. But, okay. And again, let me just assure everybody, we are going to, work our way through this, and it won't take forever. There are people, even as I speak, that are working on this. We have a team assigned and everything else. So just give us a little grace, and we'll continue to work through. But I appreciate everybody's comments, because, if you don't know exactly where the problem is, it is hard to fix. And I want to make sure that I'm doing more than just giving platitudes and having specifics that I can, direct people to look at and work through. So I appreciate everybody who is letting us know. Unfortunately, we're not going to have time for more folks, but if you've put questions in the Q&A, or you sent questions and comments prior to the webinar, I'm going to go ahead and make sure that those get over to our healthcare team, and that we continue to work through this together.
Thanks, Yvonne. I'll just repeat, there was a message that the phone number might be a little small on the screen for the contact center. So I'll repeat that again if people wanted to write it down. So it's 225-7377. And unless you have any other parting words, Yvonne, we'll say goodbye until our next town hall in a couple months.
Yeah. So I appreciate everybody getting back on. And we will, it's every other month, so it will be March that we speak again. And hopefully by the time we talk in March, a lot of this will be smoothed out. That's going to be my wish. But we'll see. And just keep plugging away. And thank you all for getting on, because I just want to tell you, it is incredibly valuable to me to ensure that we stay connected in this way. So thank you all.